Dr. David Greene with PreferredPainCenter.com, where we bring you anything and everything pain-related for education. Today I'm out at Fountain Hills, Arizona, which is a gorgeous area of the valley, probably one of the most gorgeous areas in the whole Southwest. I mean, you got awesome scenery. It's a little cooler here than it is in town, so, you know, in the middle of June, it helps out. Any little bit helps, right? The topic today is degenerative disc disease. What are the injection options for the problem? Well, let's look for a second here at the discs. So this is a model. You have your pelvis and then your lumbar spine. These areas are called intervertebral discs, and normally they're made up of 80% water. So every time you walk and then move around, these allow for an incredible range of motion, and they have 80% water. So every time you walk, some of the water gets squished out, and then it comes back in. So they serve a very useful and necessary role in your range of motion. Well, over time, that 80% number can start to decrease, and the height of these discs can start to kind of go down. And the disc can start to bulge out like a flat tire starts to do. You know, a flat tire starts to bulge out from the air, and you still have the weight of the car. Well, the problem can be that if tears start to occur in the disc, that can be painful. And that's what degenerative disc disease becomes symptomatic, and it can bother somebody every day, all day. Or it might not bother them at all. A person might not even know that they have degenerative disc disease. So it's not always painful. You know, if a person says, oh, I have 4 bulging discs, it's killing me, it may or may not be the actual cause of the back pain, because 40% of people over the age of 40 start to have degenerative disc disease and don't know it. So it's not necessarily going to be painful. So back to the ones that are painful, it can be very disabling, and we don't have the best treatments so far even with modern technology for degenerative disc disease. So some treatments that are non-operative can work really well, such as physical therapy, aerobic types of exercise such as swimming and cycling, and chiropractic treatment can benefit. There's also a treatment called spinal decompression therapy that was invented back in the 1990s and has grown exponentially in popularity because it works really well for treating degenerative disc disease non-operatively, especially when used in conjunction with some of the things I just mentioned and the injection options that are available. So there are 3 common injections that pain management doctors use for degenerative disc disease. So let's go through them real quickly here. The first is injections right into the disc. So they actually don't go from the front. Pain doctors go from the back, and they go into the disc, and they can inject steroid medication, which is also called cortisone. Steroid involves a huge anti-inflammatory, so it can decrease pain that's coming from the inflammation that gets sparked up from degeneration inside the disc. It's not going to fix the problem. That's not what the purpose of steroids is. It's basically going to dissipate the pain, probably for a few months, and then it may need to be repeated. Okay? So it can work really well. There's another type of injection into the disc, so it's sort of a subset of number 1 here, that is stem cell injections. Arizona Pain is doing an FDA clinical trial involving stem cell injections into a degenerative disc. And so far the results have been encouraging, enough so that they pumped up the study to 11 sites around the nation, one of which is Arizona Pain. And basically the thought process is to do regenerative medicine instead of just putting steroid in, to try and help fix some of the problem, as opposed to just putting the proverbial Band-Aid on it. So there's plenty of information on our website about that at PreferredPainCenter.com about the stem cell clinical trial at Arizona Pain. Okay, so the second type of injection that is done for degenerative disc disease is an epidural steroid injection. So that's not putting medication right into the disc, it's putting it right behind it in the area where these nerve roots are trying to get out from the spine. Then the question is, why would you do that? The problem's in the disc. So put the injection into the disc. Not necessarily. If you have a tear on the back part of the disc, back here, it can spark up inflammation and cause pain in these nerve roots that causes sciatica going down one or both legs. So doing an epidural steroid injection, in fact, can be very helpful in decreasing some of the back pain that can spark up from a tear in the back of the disc, sparking up inflammation. It can settle that down, and it can also relieve some of the pain coming from an inflamed nerve root. So it does, in fact, have usefulness in the treatment of degenerative disc disease. So you have intradiscal, you have epidural. Well, what's number 3? Number 3 is actually going farther back into these joints, which are called the facet joints. Why would you do a facet joint injection if the problem is inside the disc? Once again, if you have degenerative discs that start to lose height, that can cause abnormal motion in that level of the spine. It can shift more stresses to the back of the spine, called the facet joints, and they can degenerate and cause pain. So, by doing a facet joint injection or injections, you can relieve a significant amount of a person's pain. So if you do an epidural and a facet, and then maybe an intradiscal, you might be able to get rid of 70–80% of a person's pain for months. How awesome is that? So there's a lot more information on the website at preferredpaincenter.com. In fact, there's an online textbook of information that I put together. The phone number to call for help is 602-507-6550. The Preferred Pain Center in Arizona is Arizona Pain Specialists. They change lives. They have physical rehabilitation, chiropractic, board-certified pain doctors who do medications as well as interventional procedures. They're doing FDA clinical trials. They do spinal cord stimulators, the whole gamut of getting you better. I'm Dr. David Greene with PreferredPainCenter.com. Your pain stops here.